And the palatal root, as you can see here, is located, the longest root over here. So you can see again, you can trace it from the PDL. Roots of the other teeth, palatal root and the buccal root of the form, and of course you can see here the PDL and the lamina dura of the other teeth. Another view of the maxillary sinus. Remember, this is the Y, inverted Y, which you can see it in the premolar, in the canine area, medial surface of the maxillary sinus, or lateral surface of the nasal cavity, floor of nasal cavity and floor of the maxillary sinus. Here you can see an inostosis inside the that is bone growth inside the bone inside bone. Now this is one of the, of course we are not in diagnosis here, this is just came by chance. Nasal cavity and the, of course, the maxillary sinus. And now we're moving more posteriorly. In the posterior surface, see, this is the floor of the sinus. Over here, roots, mesiobuccal, palatal, distobuccal, and there is a continuous surface of the maxillary sinus. See the bone trabecules over here, and this is the maxillary tuberosity. Now, this you often see it with posterior radiographs of the posterior teeth, especially if you extend the film too much backwards towards the distal or the maxillary tuberosity. This, in reality, of course, before I go to this, see this grayish appearance, which is this area from here. You can see it also here. I'll just move the camera. See, this is actually the soft tissues or the gum, which is overlaying the bone. So this is bone up till here, while this is the gingival tissues. Gingival tissues, though they are soft tissue, but they are thick. When they are thick, they can stop some of the x-rays and they will appear radio-opaque. Of course, not like a radio-opacity of an amalgam filling or gutta-perca, but again, they will show like if you differentiate it between bone and the surrounding structure. So this is soft tissues of the gums or the gingival tissues that are covering the alveolar bone. Okay. I just want to talk about this, and I will talk about it in the coming slide. See this triangular radio-opacity here? Strangely, this is the coronoid process of the mandible. This is the coronoid process of the mandible. See what happens when you put the film inside on the palate, just to have an image of the molars. You ask the patient to open. When the patient opens, what happens is that the coronoid process moves downwards and forwards. So when the patient opens, the coronoid process will be in the way between the x-ray, then the coronoid, and then the teeth. So it will appear as such, especially if in patients with large coronoid process. This triangular portion is the coronoid process of the mandible. Another radiograph here. Remember this? This is not the zygomatic arch. This is the zygomatic process of the maxilla, and posterior to it, all this shadow over here is the zygomatic arch, actually the inferior root of the zygomatic arch, and this is the coronoid process. See, it's smaller than the previous radiograph. Depends, of course, on anatomical variation. So the zygomatic process of the maxilla and this is the maxillary tuberosity. Maxillary tuberosity tends to be a thin bone, so it doesn't appear as thick as the remainder of the maxilla. Compare the radio opacity over here to the radio opacity here. It is always this. This is the maxillary tuberosity, and this triangular portion is the coronoid process, as we talked in the previous 2 slides. The shape and the position varies from one patient to another, or not patient, from one subject to another. This is not necessarily a patient, but it just differs anatomically from one person to another. Another radiograph where you can see the floor of maxillary sinus, maxillary tuberosity, and see this triangular piece. This is again zygomatic process. This is the coronoid process of the mandible, which again shows here because it is in the way. Another one. See how big it is. It has covered almost the whole, see, all this area. So please don't get mixed up in this appearance and misdiagnose it or misinterpret it as a disease entity. This is actually one of the strange things, that the bone structure of the mandible appears, its image appears on the maxilla. I think with this slide we're done. We have finished the anatomical landmarks seen in the maxilla, and in the next session we will talk about the anatomical landmarks of the mandible. So what we have discussed here is the appearance of bone, appearance of soft tissues, or that cast a shadow on the teeth, on the images of teeth, air shadows, remember the lip shadow, nostrils and the ala of the nose, these are all soft tissues, plus other structures that would demarcate the appearance. I think by now, if we will see an X-ray of an edentulous patient, we can know from the anatomical landmarks whether this is a maxilla or mandible, and which area is this, whether it is incisor teeth or the canines or the premolars or the molars, depending on the anatomical landmarks that we will see. Okay, thank you very much.